A social infrastructure in India. What is social infrastructure? Social infrastructure refers to all those facilities and institutions that enhance the quality of human capital. Educational institutions, hospitals, nursing homes, housing facilities, etc., are some of the examples of social infrastructure. The availability of such infrastructure raises the human productivity, thereby improves the quality of standard of living. Unlike economic infrastructure, social infrastructure indirectly increases the productivity and production of goods and services. For example, availability of better healthcare and medical facilities enables a perennial supply of health workforce that in turn is reflected in the form of increased production levels. To engineer an inclusive and sustainable growth of India, the social infrastructure like education, health, and social protection are being given utmost priority by the government. Social infrastructure caters to the social needs of the society, such as education, health, housing, etc. Infrastructure, by its basic definition, means something that helps in production. Here, social infrastructure relates to the betterment of the society. Investment in human capital is a prerequisite for a healthy and productive population for nation building. Being a developing economy, there is not enough fiscal space to increase the expenditure on critical social infrastructure like education and health in India. Now we will discuss the trends in social infrastructure spending. We will use two types of data. One is the data given by RBI, which expresses social infrastructure spending as a percentage of the total expenditure of the government, especially the budget expenditure of the government. After that, we will discuss how much portion of the total GDP has been spent on the social infrastructure in India. Reserve Bank of India data on expenditure on social services by the government, both the central and state governments, as a proportion of total expenditure has been showing a mixed trend. For example, it had declined to 22.9% in 2012-13 from 24.7% in 2010-11. So in 2010-11, the social sector spending as a percentage of total expenditure stood at 24.7%, but by 2012-13, it had declined to 22.9%. But in the next year, 2013-14, it increased it to 24.1%, but again declined it to 22.3% in 2014-15. It does mean that it has been a mixed experience. That means the trend has been mixed in our country. As a percentage of the GDP, expenditure on social services has declined from 6.9% in 2009-10. So we spent around 6.9% of GDP in 2009-10 for social sector infrastructure, but it declined to 6.7% in 2014-15, while expenditure on education increased from 3% to 3.1%, on means on education, and health increased from means on health it actually declined from 1.4% to 1.2%. Education expenditure actually increased from 3% to 3.1% in between 2009-10 to 2014-15, and expenditure on health declined from 1.4% in 2009-10 to 1.2% in 2014-15. Now, public investment in social infrastructure like education and health is very critical for the development of an economy. However, the expenditure on social services by the center and states as a proportion of GDP has remained in the range of 6% during 2012-13 to 2014-15. There has been a marginal decline to 5.8% in 2015-16, which has further moved to 6.6% in 2017-18. Now, education for all. Now we will discuss the education sector. In social infrastructure, education infrastructure is very important. The government of India is committed to achieving the Sustainable Development Goal SDG 4 for education. The goal is to ensure inclusive and quality education for all and promote lifelong learning by 2030. With a view to achieve the goal of universalization of elementary education, the Right to Free and Compulsory Education RTE Act 2009 had been enacted in 2010 that provides a justifiable legal framework entitling all children between the ages of 6 to 14 years free and compulsory education, compulsory admission, attendance, and completion of elementary education. It provides for children's right to an education of equitable quality based on principles of equity and non-discrimination. India has made significant progress in quantitative indicators such as enrollment levels, completion rates, and other physical infrastructure like construction of school buildings, classrooms, drinking water facilities, toilet facilities, and appointment of teachers, etc., at elementary school level. The RTE Act, Right to Education Act 2009, lays down the guidelines for maintaining the norms and standards relating inter alia to people-teacher ratios (PTRs), building and infrastructure, school working days, teacher working hours in both primary and upper primary schools. The impact of pupil-teacher ratio on learning achievement is widely discussed, with some studies claiming that school participation and grade attainment are positively influenced by student classroom ratio and the PTR ratio. So student classroom ratio and PTR ratio, both are very important. And the grade that the students get in different classes and the participation of the students in schools, they are positively influenced by students classroom ratio. That means how many students should be there per classroom and how many students should be there per a teacher. Students classroom ratio and people's or students teacher ratio. So both are highly correlated with the school participation of the students and grade attainment. Let us come to the student classroom ratio. Student classroom ratio is defined as average number of pupils, students per classroom in a school in a given school year. The ideal size should be at 30 students per classroom. At all India level, percentage of schools with SCR greater than 30 students declined from 43% in 2009-10 to 25.7% in 2015-16. That means we have made good improvement in respect of the student class ratio. The ideal ratio is 30, and before 2009-10 there were more schools with this ratio moving ahead of this 30, but by 2015-16 we made rapid improvements in this, and the schools with the SSCR greater than 30 students actually declined from 43% in 2009 to 25.7% in 2015-16. So that the number of schools with more than 30 SSCR ratio actually declined to 25.7%. It's a very great achievement, but still there are more schools with more than SSCR, so that should also be reduced. Though SSCR improved in almost all of the states, there are variations in the improvement across states. Now, pupil-teacher ratio. At primary level and upper primary level, the PTR should be 30:1 and 35:1 respectively. It means that at the primary level, there should be 30 students for one teacher, and upper primary level, it could be 35 students per teacher. As per the Unified District Information System for Education, UDISC, the PTR at national level for primary schools is 23:1 in 2015-16. Globally, there are variations in the optimal number of students taught in a particular class, and as such, the data is not uniformly comparable. Data from the UNESCO Institute of Statistics on PTR in primary schools shows that India has a national PTR comparable to countries with similar socioeconomic indicators. Most of the states in India reported an improvement in schools complying with the PTR norms of RTE Act, Right to Education Act during 2009-10 to 2015-16. However, despite improvement in number of schools complying with the PTR norms, states like Bihar, Jharkhand, Madhya Pradesh, and Uttar Pradesh have higher percentage of schools with more than 30 PTRs compared to other states. Now, Gender Parity Index (GPI). Gender Parity Index in education is a valuable indicator which reflects the discrimination against girls in access to educational opportunities. In higher education, gender disparities still prevail in enrollment, for which continuous efforts are being made by the government to improve net intake rate for women in higher education. With consistent efforts by the government through programs like Beti Padhao, Beti Bachao, the GPI, Gender Parity Index, has improved substantially at the primary and secondary levels of enrollment in India. Now, second important social infrastructure is health. Our aim is to provide health for all. Ensuring healthy lives and promoting the well-being for all at all ages is essential to sustainable development SDG 3, Sustainable Development Goal 3. India's commitment to achieve the targets under SDG 3, with some of them also aligned with the National Health Policy 2017, will help in strengthening health delivery systems and in achieving universal health coverage. Let's come to the health expenditure on health. Expenditure by the government by the government healthcare providers accounted for just 23% of the current health expenditure as per National Health Accounts 2014-15. That reflects the prominence of private hospitals and clinics among healthcare providers. That means around 77 percentage of the total healthcare expenditure comes from the private sector in our country. The expenditure on pharmacies accounted for 29 percentage of total expenditure by healthcare providers in our country. In a developing country like India, incurring higher levels of out-of-pocket expenditure on health adversely impacts the poorer sections and widens inequalities. Although out-of-pocket expenditure has declined approximately 7 percentage points during the period 2004-2005 to 2014-15, its share is still at 62% as per national health data. Even though over the planned periods, the number of community health centers, primary health centers, and sub-center has increased substantially, infrastructure facilities in the health system remain inadequate in our country. Of the total dispensaries and hospitals in the country, 46% and 67% are found in the urban areas, respectively. That means it is more urban centered. The health infrastructure in our country has been more urban centered. The larger outpatient care is a monopoly of the private health sector. Of all the dispensaries and hospitals, 54% and 73% are respectively privately managed. Most of the, more than half of the hospitals and dispensaries in India are privately managed. Then the following are some of the important characteristics of in Indian infrastructure, especially education and health infrastructure. It has been repeatedly observed in India that education and health services are characterized by inadequate and inferior infrastructure, poor public service delivery, lack of quality choices for consumers, lack of access, especially for the poor, due to a high dependence on relatively expensive privately provided services. Now we come to the third social infrastructure, which is housing. Housing is very important because house provides shelter. A good shelter is necessary for comfortable and tension-free living. The government provides housing facilities to many employees in India. the formulation and implementation of housing program is under the state government. The center, however, supplements the state government. Rural housing schemes. Several schemes have been started by the government to solve the problem of rural housing. The Indira Awas Yojana was introduced in 1985-6 for the poorest of the poor belonging to the scheduled caste and tribes and freed bonded labor in rural areas. Houses constructed under this scheme are under clusters so that common facilities can be provided to those clusters. Housing schemes and Housing Urban Development Corporation has been financing several housing schemes by allocating 15% of its resources to such schemes. Urban housing schemes. Urban housing schemes started by the government in the urban areas are as follows. Social housing schemes for different income groups operated by the states and city level agencies with the budgetary support and loans from HUDCO, LIC and other financial agencies. As part of Nehru Rozgar Yojana, housing and shelter upgradation for the urban poor was introduced in 1989 in cities with a population between 1 and 20 lakh.